Okay, noting the panel is on good behavior and already seated, let me go ahead to set up this session. It's moderated by Kedar Mate, who's a member of the planning committee for this workshop. And Kedar is an assistant professor of medicine at Cornell and senior vice president for innovation at IHI. He's previously worked with Partners in Health, served as a special assistant to the director of the HIV/AIDS department at WHO, and led IHI's national program in South Africa. We have 3 people on the panel, one remotely. I don't know in what order, but I will just do the introductions. So Dr. Rashad Massoud. Rashad is a physician and the director of the USAID Applying Science to Strengthen and Improve Systems, called the ASSIST Project. He's also Senior Vice President of the Quality and Performance Institute at URC and leads URC's quality improvement efforts in over 30 countries. Rashad was also an early pioneer in the application of collaborative improvement methodologies in middle and low-income countries. Mike English is a senior research fellow at Kemery Wellcome Trust. He's a pediatrician, has extensive experience working in Africa, also a professor of international child health in Oxford since 2010. His work focuses on developing and testing national evidence-based guidelines for care of severely ill newborns and children, and provides technical advice to WHO on a wide range of issues related to child and newborn survival. Javier will be joining us remotely. He is a physician with a specialty in public health, and he is the group leader for the Evidence Evaluation Policy Unit at the Swiss Tropical and Public Institute. He's been living and working in rural settings of sub-Saharan Africa for 10 years and has worked in more than 20 countries. So over to you, Kedar.
Thank you, everybody, and welcome back from lunch. This panel is the second of the 2 panels that is going to be covering the 6 primary interventions that we're considering today. This panel will consider the improvement collaboratives, in-service training, and supportive supervision. And so we'll do it just the same way that we did the previous one, 10-minute talks from each of the panelists, and then half an hour for discussion and questions. So without further ado, Rashad, do you want to kick us off on the collaborative?